answers, and I want to make sure that we cover this very important topic today because it's been coming up a lot as I work with clients and people who are seeking better health. The question often comes up about blood work and what blood work should we get, what kind of blood work is covered usually versus private pay, and is it worth getting that kind of blood work? Okay. So I see I have a viewer, and hi, if you put your name and where you're calling in from, that would be amazing. Okay, so I'm a doctor practicing in Canada, right? So I have that lens. So if you're from another country, of course, this is going to be slightly different, but I think that the general idea that the government, like the publicly funded services plans, don't cover everything that is available in terms of blood work. Not that we have to do everything that's available in terms of blood work, but I would say that in today's day and age, when there are a lot, like there's a huge exponential rise of chronic diseases, degenerative diseases, and it's out of proportion with the growth of the population. In other words, it's not just that there's more people being born, so there's more people with these conditions. It's that more people, like a greater percentage of us, are getting it. And I can't tell you how many times I'm getting calls about friends and family and known acquaintances with family members that are getting sick with things from cancer, Parkinson's, ALS, Alzheimer's, heart attacks, strokes, diabetes, hypertension, all those things, right? Those are all chronic and degenerative diseases. And what we want to do is acknowledge that the medical system that is paid for publicly in most countries, the blood work there is used to detect existing pathology when it's already manifesting massively. Okay, so like for example, diabetes. Diabetes is diagnosed where the diagnosis of diabetes, type 2 diabetes, is made when your blood sugar and other tests that are a reflection of your blood sugar are already like quite bad. Like, if you think about a spectrum, so let's say that you're engaged in a lifestyle that will give you diabetes in the future, and you don't know, right? Obviously, you wouldn't purposefully be doing this, but the standard American diet and the standard American way of living is causing this to happen because we are getting exponentially more type 2 diabetes, as an example, and that's when your body can no longer process sugar properly. The sugar starts to build up in our tissues and in our bloodstream, and that causes damage over time. Like, the number one cause for amputations in the legs is type 2 diabetes, loss of vision, aging. You age much more rapidly with that condition. Um, and heart attacks, strokes, hypertension, all those things are all interlinked because that the excess sugar in the body definitely causes inflammation, and that's when you get the weight gain, even though you're trying all the things like working out and that kind of stuff. So and it's because the excess sugar causes an imbalance of your hormones, because one of the hormones, insulin, responds to the excess sugar. And so if you're imbalancing insulin, you're imbalancing all cortisol, estrogen, progesterone, testosterone, and you increase your risk of cancer and all those things. Okay, so let's say you're on this like trajectory for getting that. Okay, now and you go and let's say you're in the beginning phases of that where you're engaged in the lifestyle, but you're still young. You haven't really hit the capacity of your body to deal with it. If your doctor were to do the blood test for diabetes, it wouldn't show any issues, but you're still on that trajectory, okay? And then it keeps getting, let's say you keep staying on that lifestyle and your body starts to decline in health, decline in health, decline in health, like your health problems start to rise. If you went into your doctor, it's very likely that your blood work would still be normal, actually, okay? It's when you hit a certain threshold, when you already are in like kind of the horses out of the barn to a certain extent, although I do believe you can always lead a horse back to the barn, but you're pretty deep into your health issues with something like diabetes. I'm using diabetes, but anything could apply. That's when your blood work with your conventional medical doctor will start to be abnormal. So at that point in time, you have to make some massive, massive changes in order to reverse this down. Whereas if you were to catch it earlier on and make those changes earlier on, it would be so much easier to return to health. So the example of diabetes is actually a really good one because if you, let's say you go to your doctor and you get your regular blood work, they would test your fasting blood sugar. If you had a family history of diabetes, let's say, if you don't, they might not even test that. That's not even something that would come up. They would might test like a regular blood panel looking at your blood count to see if you have anemia, and the type of blood cells that you have, just to make sure that they're like not too much or too little of each one. They might check your iron levels. And then they could check your hemoglobin A1C, which essentially is a marker where they take all of the red blood cells in the slide that they take, like they take your blood, look at all the red blood cells, and they see which ones have been tagged with sugar. And the more sugar you have in the blood, like the excess sugar, the more of those red blood cells that will be tagged. And they'll look at the percentage of those red blood cells that are tagged, and they'll say, well, below 6% is normal, and above 6%, you're starting to get into issues. Now, if you have like any amount of red blood cells tagged with sugar in the blood, like a few is okay, but like 6%, that's quite a bit, right? Like you should not have excess sugar floating around in the blood. You should have enough for your body to have energy, but not enough that it starts sticking to things like your red blood cells. And if it's sticking to your red blood cells, it's sticking to your arteries, it's sticking to your tissues, it's going into your brain and causing damage there. So as we say, that's like by the time you hit that percentage, you're already in like the disease zone. So now you get labeled with the disease, but there's still all of this opportunity to take action, right? To not get there, because by the time you get to this point, you are already having downstream effects on your health. Like your arteries start to be damaged by the sugar, and that's not good. Arteries are like the vehicle of like blood, which is life, right? So for example, one test that is not commonly done by conventional doctors is what's called a fasting insulin test. Okay, that's an interesting test. Insulin hormone is the hormone that is released in response to excess sugar. And when I mean excess sugar, I mean a lot of fast carbs in the diet. And in the ebook, the free ebook under announcements, I explain the difference between fast carbs and slow carbs. Fast carbs, quick release of sugar into the body, like from pasta, refined flour, bread, pastries, cookies, sugary cereals, most breakfast cereals, those sorts of things, fruit juice. It's like, whew, right? Versus slow carbs is like whole grains like white basmati rice, soaked overnight oats, certain breads like the Ezekiel breads, which are whole grains, not flour bread, but whole grain bread, without preservatives and all that kind of stuff, and vegetables. Okay, those are slow carbs. So slow carbs versus fast carbs. And if you consistently are engaging in fast carbs in your diet, that causes your insulin hormone to go up. And that's like the very first thing that's going to start happening is your insulin hormone is going to go up. And when it's and what the lowest point that it should be at, right, is in the morning, because theoretically you've eaten your meal and then you go the whole night without eating, right? And sorry, ladies, if you're giving me comments and I don't see them, and I'm not answering, it's because I don't see them. So I'm gonna just try and see if I can turn on my phone and see. I thought the comments was working, and it may be, but could someone please put in a comment just for me to know whether or not this is working? So let me see here. Let me just go to my groups here. Okay, here we go. Am I even live? Okay, well, I'm live on the screen, so that's good. I don't see it here. All right. So please put in a comment just to let me know that this is working. If I'm not, I'll go in and answer the comments after the fact if I'm not answering your comments now, okay? Perfect. So with the so basically with the you haven't been eating all night long, and so your insulin should be lowest in the morning, right? On fasting, like you haven't had anything for breakfast. If I were to do a blood test to test your insulin level, your insulin hormone level, that should be really low because it hasn't had a stimulus to be high, right? Now, if I take that blood work and your insulin level is high, that tells me a few things, okay? One is you've been having either or too much fast carbs or too much fast proteins. Why? Because the other thing that stimulates insulin too much is refined protein, so protein powder, okay? And dairy. Dairy is a huge insulin responder. Why? Because insulin one of the jobs of insulin is to take the energy and store it, right? Store it into the cells, and whatever's left over, store it into fat. And if you're a growing animal, you want that stored energy to grow. Well, after a certain age, you don't want to grow anymore. You don't want to grow sideways. You don't want to grow cancer. So that's one of the reasons why I actually don't eat dairies, because I no longer want to create this hormonal imbalance through triggers of the specific kinds of protein. So different kinds of protein will cause insulin to be triggered more than others. And cow's milk, for example, is one of the massive insulin. So if I take your fasting insulin in the morning and it's high, it tells me either you're having too many fast carbs consistently, because if it was a one-off, your body would be quite easily adjustable. It would, like, the insulin go up and then down. But if you've been doing it consistently and persistently, the insulin will stay high, okay? And that will be your signal that your diet is not working well for you. Either too many fast carbs, too many refined proteins like powders, or too much dairy, okay? And then what do you do with that information? You say, okay, well, I know that the insulin is too high, which means that this is imbalancing my cortisol, my stress hormone, and it's imbalancing estrogen, progesterone, and testosterone, because they are all linked. And that impacts my thyroid, which impacts my whole body metabolism. Do you see how it's like a full cascade? So the nice thing about the fasting insulin is that it does give you like a window into your metabolism, okay, to see how is your metabolism, your hormonal balance, and your energy storage and production systems and all that stuff. How is it reacting to your current lifestyle? And I think the reason that conventional medicine, so if you ask your doctor for this, actually, they might even order it, and you may not even have to pay for it. Although the problem that doctors face is that if they start ordering a test that is not standardly ordered, the government actually, like the governing bodies actually, will come to the doctor and say, why are you ordering this test? It's not standard. And so what are you doing with this information? Like, how is this changing your treatment, or your treatment or your paradigm? And if the doctor isn't aware of the conversation they should be having with you, that your fasting insulin's too high, they might say, oh, well, I don't actually know how this is treating my treatment paradigm, and they might stop ordering it. So you see, you have to find a doctor who is willing to engage with you in this process, who is willing to order you the blood work, who is willing to make the case for when he or she is told that they are ordering tests that are not routinely covered. And it may be that they come to you and say, listen, I can order this blood work, but you will have to pay for it. And then you say, sure. Because the truth is that you have to prioritize your health. And if you would pay $100 for a pair of jeans, paying much less than that to find out like the state of your metabolism is probably worth it, I would say. So it's a matter of recognizing that if all we do is sit back and blame the system that they're not covering the drugs, the tests that we need, but we don't do anything about it, then all we're sitting is in a place of blaming, but not in a place of empowerment and action. Okay, so I invite you to ask your family doctor to do a fasting insulin level on you. And if they ask why, just say, type 2 diabetes is on the rise. And my understanding from what I'm learning is that fasting insulin is one of the earliest detectors of this. I don't want to find out I have this issue when it's already in full blown. I want to be in preventative mode. And if they give you any resistance, just say, I'm happy to pay for this test if you order it. If they still resist, because there is a subset of doctors who are quite stubborn, unfortunately, and what they don't know they're uncomfortable with and they don't want to order, then you have to go to a naturopath. And then and then when you're with the naturopath, you can ask the naturopath about anything that they recommend in addition, and they can explain to you the pros and cons of any of those tests. So I'm just logging back in to see if it's showing the live. Okay, I see. Okay, the comments is working on here, but not working. So Irene is asking, is dairy still good for kids, or as they are growing, are also not necessary as for adults? Okay, that is a totally different topic that I'm not going to get into right now simply because it is a huge one. So, what I'm going to do is I'm going to save that for another day. In broad strokes, mother's milk is really important for the first, 3 years of life. Because these kids do need to grow quickly and rapidly with a lot of energy. So, yes, dairy is important until breast weaning age. And obviously, with today's day and age, we're not able to breastfeed for that long, or some women can't breastfeed at all. I was one of these women. I just simply could not successfully breastfeed at the time. And so, what I did is I bought like the very best quality breast milk on the market, cow's breast milk on the market. And for example, the brand I went with was HIPP. And the reason for that is because it's grown from like happy cows, pastured in Europe with lots of sunshine. It had the minimal amount of additives. And so I would say that for children who are below the breast weaning age, after until the age of 3, yes, it can be helpful. Although a lot of children have allergies to cow's milk. Why? It's a much more complex protein than human milk. Okay, if you look at the protein structure, you have human milk, sheep and goat's milk, and then cow's milk. So humans tend to have more problems with that. So we have to pay attention. And if they have issues with that and they're still needing milk because they're still in that age category, then you would be looking at something like a goat's milk or a sheep's milk derivative. There is documented issues with soy milk being the predominant milk given in that age. And so I would not necessarily recommend that unless you're really, really stuck. And then I would say that there's other ways that you can, supplement nutrition for your child. However, that is a more complex topic because it does involve debunking a whole cultural, societal, historical kind of paradigm. And it would involve me really presenting the research to you and leading you down a path of I'd have to like especially because we tend to have a visceral reaction, like we're like, oh, but I love dairy, or my kids love dairy. And there's this visceral reaction to it. So a lot of people, when they hear this, they're just going to shut down. They're just going to shut down and say, I don't want to listen anymore because I love dairy and my kids love dairy. There is a compound in dairy called casomorphine. So it's a morphine-like derivative. And so dairy actually has a bit of an addictive potential, which is great when you're breastfeeding, and then naturally wean off of breastfeeding. And so the child kind of naturally is taken away from the breast milk, and then that kind of chemical addiction kind of clears. So that's an addiction set up by nature. But it becomes really hard to break the habit as an adult when you've been having it for longer times, or you've been having it in large amounts, and you associate it with your favorite meals and your favorite breakfasts and the taste and the comfort, because it's very comforting. It's like mother's milk, right? And it's a great mouthfeel for people and things like that. So it's a tough one to go into and to give up. And it's not my expectation that people will give it up, but I just wanted to raise awareness that if you have like a high fasting insulin level and you're thinking to yourself, well, I don't eat very many fast carbs, think to yourself, am I eating a lot of protein powder, in which case I cut that out, or am I having a lot of dairy? Okay, do I have like a prolonged kind of association with dairy, and even the thought of giving it up gives me the heebie-jeebies, and that could very well be accounting for that. So that's the only comment I see here. Thank you so much for that, Irina. And so I hope you found this useful. Fasting insulin is one of the tests. Over time, we'll go over like a variety of tests. But I don't want to overwhelm you with information. It's a lot to take in. And I want to make sure that, these knowledge exposures are like manageable and doable and actionable for you. Okay, remember, wisdom is knowledge in action. So I invite you to look this up, and I'm seeing kids, even like children who are on a standard American diet having high fasting insulin. So you're never too young to check this out, by the way. So that's very important to know too. And you don't need a family history of diabetes to be at risk for that. All right. So genetics loads the gun, environment pulls the trigger. But we all have guns, so to speak. We all have the capacity to develop it. So you could have really great genetics and you can get dirty genes just from the standard American diet and lifestyle. And so you can get expressions of things that never happened in your family before, and that's why that's happening. All right, and that's happened in my family as well. So I hope you found this useful. I hope you have a really wonderful rest of your day, night, or evening whenever you catch this replay. Bye. Mwah. Thanks for joining, Irina, and everybody else who joined as well.